wisely and that restrictions are eased in a responsible and measured manner. We had anticipated taking the next step in emerging wisely incrementally by accepting fully vaccinated leisure travel into the Northwest Territories with some associated safety measures. Unfortunately, what we are seeing right now across Canada and globally regarding the Omicron variant means that this is no longer the case, and it is necessary to postpone this step. We are continuing to monitor what's happening with our national partners. The current landscape poses too much of a risk at this time to open up to tourism just yet. The federal government is recommending only essential travel outside of Canada, and many other jurisdictions are tightening up restrictions to mitigate the risks that Omicron may bring to their residents. We have been contemplating how allowing tourism can be done safely and hope that later in the new year, we will be in a better place to welcome back fully vaccinated tourists to the Northwest Territories. And we ask that you remain patient as we continue to adapt to meeting the demands of this pandemic. For now, all travelers, including residents entering the Northwest Territories, are required to complete a self-isolation plan. Non-residents must receive an approved SIP prior to entering the Northwest Territories. We have updated our travel orders so that they are more streamlined and address the current needs of our residents. And Protect NWT has been working hard behind the scenes to prepare for the public health orders update. If anyone has questions regarding the changes to the order, they can reach Protect NWT by calling 811 or emailing protectnwt@gov.nt.ca. So one final reminder for everyone, getting vaccinated is a very safe and effective way to protect yourself from COVID-19 infection, as well as the severe health outcomes from the disease. And if you are not fully vaccinated or fully boosted, please reach out to your healthcare provider to book an appointment or discuss any concerns that you have about the vaccine. I hope that everyone celebrates the Christmas and holiday season safely. Set your safety nets and evaluate your own personal risk. Make decisions accordingly to the public health measures in place. Thank you for the work you have done this year to help keep NWT safe. Merry Christmas and happy holidays.
Thank you, Dr. Kandola. And thank you, Minister Green. We will now move on to the question period of our briefing. As a reminder, please do keep your microphones on mute until you're called upon. And please indicate who you would like to direct your question to before you ask your question. That's very helpful to us. If you're not sure, we can help you do that as well. So I posted the question order in the chat. We're going to begin with Ian from NNSL, and then go to Sarah from Cabin Radio, and then Laureen from Radio Canada, then Julia from CBC, and then Média Ténois. So I will start at the top with Ian from Northern News Services. Ian, can you hear me? Do you have a question?
Yes, hi. My question, I believe, is for Dr. Kandola. So you said there have been no confirmed cases of the Omicron variant in the NWT, but I'm curious, what implications would the arrival of the Omicron variant in the NWT have for the current restrictions?
So what we have put in place right now is that 72-hour window, because based on what we're seeing across Canada and nationally, it appears that it takes a shorter time before people become mildly symptomatic with the current variant. So we anticipate our biggest risk right now is importation risk. So within 72 hours, we anticipate people could be symptomatic. So we're asking them to decrease their activities in the first 72 hours, limit their gatherings. It's a recommendation. And if they are symptomatic, they should get tested. So that's our first wall of defense. The second one is the territorial gathering restrictions are still in place, and we're going to maintain that. So it's the default is 25 indoors, 50 outdoors. And if people are needing to can safely gather larger numbers, then they can apply to vary from that. We still have the mandatory masking order in place for indoors. So with that mandatory masking, we're and I've done that for a number of media briefings. Please upgrade your mask. Make sure your mask is 3-ply, has a good fit, um, filtration, and good function in terms of breathability. The best masks that the Public Health Agency in Canada is recommending right now are the medical surgical type masks. And for those who are increased risk of COVID severe outcomes or transmissibility, they're even upgrading that to an N95. So upgrade your mask, if you're able to. But finance is cost is if this is a financial hardship and you have a non-medical mask, just make sure you have a filter between the 2 layers, and so you have a 3-layer mask, and make sure it fits and you don't have air coming out from the sides. And please keep the mask over your nose and not under your nose. If you keep it under your nose, you pretty much might as well not wear a mask. It needs to cover your nose, your mouth, and not have air coming from the sides. If you're sick, if you have any symptoms, stay home, get tested. The vaccine, again, NWT had a 6-week lead start than any other jurisdiction because we opened up our vaccine program to 18 plus October 29th, I believe. And we have about 38% of our adult population is boosted. We also are opening up to 16 and 17-year-olds. The one additional layer of protection that we will be doing is that if you return from travel and you have COVID, we are asking people to isolate in place because this is such a highly infectious variant, different than the Delta. Unfortunately, if you're with your household would be already exposed. And so we're asking the individual with COVID and the household members to isolate in place. So we won't be moving them out of the community, moving them into hotel settings. We will be keeping them isolated in their own home. So these measures we have in place in the coming weeks, and we'll continue to monitor the Omicron variant in the Canadian setting and see what impact it has on hospital admissions, ICUs, even deaths. And if it starts to stress our health system capacity, then we would have to look at additional measures. But at this point, I feel these measures are sufficient.
Thanks, Dr. Kandola. Ian, do you have a follow-up question?
Sorry, I guess my question was, let's say we did confirm a case of the Omicron variant in the NWT, would that change the current restrictions?
The current restrictions we have in place for a case, it would still remain the same. We would treat the Omicron variant similar to what we've treated people who have other variants, is that they need to isolate, the household needs to isolate, and we would continue to monitor the close contacts. They would have to isolate. So our approach on testing, tracing, isolating, that would not change. Our restrictions are still effective. We have restrictions in place. We have travel restrictions, masking, gathering restrictions. So none of that will change. So if the question is, would I move to a containment and gathering order? That's too early. Mainly we would try to contain any cases of COVID as much as possible for our usual means of the test, trace, isolate.
Thanks for that, Dr. Kandola. Ian, I'm going to give you another question since I think you asked kind of the same question twice for clarification. So go ahead if you have a second one.
Okay, perfect. Thanks. So I gather from the documents that were sent out that there's kind of a vaccination gap between the larger communities and the smaller communities in the NWT. Is there any sort of plan or strategy to address this gap and promote vaccination in the smaller communities? I guess this question is for Minister Green.
Minister Green, go ahead.
Just getting myself off mute. Yes, I don't have the details of our vaccination offering, but it is our goal to ensure that that every 15-year-old, 0 to 11-year-old who wants a vaccine receives one as soon as possible. But having said that, we recognize that there's not going to be a lot of point in traveling over the next 2 weeks because a lot of people will be away for Christmas, whether they leave the NWT or not. They won't be lining up at vaccine clinics. So what we're going to do is redouble our efforts early in the new year to make sure that everyone has had an opportunity to be vaccinated, because that's obviously key in this situation as well. It reduces the severity of illness in the event that somebody is infected by Omicron or any of the other variants. Thank you.
I'm just going to open that question to Dr. Kandola, just in case you have anything to add, Dr. Kandola.
So we do see a discrepancy in smaller communities versus regional centers, but the good news is that when you look at 12 and older and 18 and older, every single community has achieved at least 75% immunization in that category, and so which is excellent. So we've seen an uptake, and that gap is narrowing. Specifically, what we noticed whenever we introduced the vaccine initially to 18 plus, then it was to the 12 and under 18, and now 5 to 11. It's even though we're at almost 50% of that age group, we always see that it takes time, it takes trust, it takes information before, over in a few months, before we start to see an increased uptake in the smaller communities. So we are planning to do more community engagement, as Minister Green has stated, in mid-January onwards, specifically targeting communities that may need have more information, maybe initially vaccine hesitant, and that we can actually engage more at a personal level by going to the community and talking to the leaders, talking to the community themselves. But we do see, like I said, it takes months and it takes time before we start to see an increase in uptake in that particular setting.
Thanks for that, Dr. Kandola. I'm now going to go to Sarah from Cabin Radio. Sarah, do you have a question?
Yes, please. Thanks for having us here to ask some questions today. I believe this first one is for Dr. Kandola. I was just hoping to ask, like you said earlier, the initial plan was to kind of open up some more tourism. Obviously, because of the current situation we're seeing now, that's not happening. Can you clarify a little bit maybe about what your threshold is for being able to take that step to open up tourism operators in the NWT or tourism in general?
Yeah. So we really need to see what's happening nationally at this point. One of the things is that we've just seen a rapid increase of this Omicron variant. It's going up, cases are going up thousands per day, and significantly increasing in Ontario, Quebec, and the eastern jurisdictions. So we've seen a rapid increase of a new variant that has multiple mutations. That is a cause for concern. But what I'm looking for is, does this rapid increase, is this going to stress the healthcare system? Are we going to, after a lag period, are we going to see an increase in hospitalizations, ICU admissions, unfortunately even deaths in the provinces harder hit? And that will take about 2 to 3 weeks to see. We are seeing promising news from South Africa, where they've seen a reduction in hospitalizations, and they see mainly cold-like symptoms and not the fever, cough, or loss of senses, taste and smell of the previous variants. That's promising for South Africa, but we have to see how is it in Canada, where we have an older population, where we don't have as high of natural infections that they've had, and where the situation is different, colder, drier environment. So we'll see in 2 or 3 weeks what the impact is. And then then we can make decisions based on that. What I am strongly encouraging people to do, though, is still encouraging people to get a booster, because we know that seems to work against this variant, so that we have reduced spread, um, even if you're not traveling. So if NWT itself is more robust in their immune response, then we can take on more travel, take on more additional risk in the new year.
Thanks for that, Dr. Kandola. Sarah, do you have a follow-up question?
Yes, and thanks for that answer, Dr. Kandola. I think this one's probably directed your way as well. So these new public health order changes are announced right before the holiday period. Are you expecting these to only last for that kind of few weeks that you were talking about, or is this kind of part of the new normal that you've been talking about that we're transitioning into?
So the way I look at between now and spring, I'm looking at a transitional period where we have a new normal. We take on relax the orders a little bit more, but still manage the impact on the healthcare system. But understanding we're also in the dead of winter, more people are indoors, and now we have this highly aerosolizable variant that can spread pretty quickly. However, the measures that we've taken, it just makes life just more functional. We can have normal functioning of society, less school disruption, less work disruption for the parents, but still maintain safety. So this is the approach to this order. It's not going to change until we see the impact of Omicron on the healthcare system. We see the other jurisdictions achieve a peak because they're rolling out the boosters as quickly as possible. And when we are going to change, it will be to finally complete what we had stated in the emerging wisely, to open up to leisure travelers. That's our next big change.
Okay, thank you, Dr. Kandola, and thank you, Sarah. Next, I'm going to go to Laureen from Radio-Canada. Laureen, are you there? Or is there another person from Radio-Canada? Oh, I see you here. Perhaps if you're speaking, I can't hear you. Oh, your mic isn't working. Okay. No questions from Laureen. Okay, we'll move along to Julia from CBC. Oh, here's Julie. Here, I'll read Julia's question for you. It's for Dr. Kandola. In a news release earlier this week, you said the Northwest Territories COVID-19 risk has shifted from community spread to risk associated with COVID-19 importation from travel. At this point, the OCPHO can clearly trace new COVID-19 infections to travelers returning from trips outside the NWT. Unless these concerns have changed since Monday, is the NWT expecting to see a rise in cases of COVID-19 due to travel once these less restrictive public health orders are in place?
So the what we have seen. So I've looked at our travel from last year this time with the consolidated COVID Secretariat stats, and I've looked at our travel right now. And last year we were averaging about 700 cases per week around now, and the last 2 weeks we've had 2,000 people coming in, and not cases, but travelers. So we had about 700 travelers coming in during this time last year per week, and now the last 2 weeks it's been 2,000. So our number of travelers coming into NWT has increased 3 times compared to last year. But the good news this year is we're looking at a very highly vaccinated population. So we have Transport Canada rules where you have to be fully vaccinated if you want to fly commercial air, which is what we use, and then we have the addition of, we've now expanded vaccines to 5 to 11-year-olds, and a lot of them will be about 14 days after their first dose. So they have good neutralizing antibodies. So when they return, I'm not worried about them. That it's a population that would have we would have had school outbreaks, but now they've received the first dose. We have things in place for non-fully vaccinated, so we can test them day 8, and by day 8 Delta or Omicron, they pretty much would, if they were to develop those two variants, they would have been within the average incubation period. So I'm comfortable with that. And then we have the 72-hour recommendation rule. So that one is a recommendation, and how we respond to that. If we limit our gatherings, limit high risk activities, wear masks, and limit our risk to others, if on after 72 hours you do a test and you're positive for Omicron, it'll be less of a trace back for those fully immunized who aren't required to isolate. So that is where I want to put my emphasis. That's where I'm asking the public that this will be a shared responsibility. It's not an order. I'm not requiring people to isolate for 72 hours. I'm asking you to decrease your gatherings to protect the public for the first 72 hours until we can determine that you did not bring in Omicron.
Thanks, Dr. Kandola. And Julia says she doesn't have a follow-up, so we'll move on to Thomas from Média-Ténois. Thomas, can you hear me? Thomas, he wrote it. Oh, I'm sorry. He did write a question earlier. Here is his question. Concerning the exemptions made for compassionate or family reunification, are those people included in the new requirements, even if they're not residents?
Yes. So that we still allow families to visit. We still have compassionate exemptions. We still allow non-resident workers to come. The only, unfortunately, the one class of people that we can't take on right now are people coming into NWT for leisure purposes.
Thanks, Dr. Kandola. I've asked if Thomas does not have a follow-up question, so I'll go back to the top of my list, back to Ian from Northern News Services. Ian, do you have another question?
Yes, I hope it's all right if I just clarify something first. Dr. Kandola had mentioned something about every community having a vaccination rate of 75% or more. Was that for 18 and over or 12 and over?
12 and older. It's
Okay.
it's for both. So if you go onto the COVID dashboard and you click on 18 plus, every community is a green dot. If you move to 12 plus, every community is a green dot. We now have a default is the 5 plus, and right now with 5 plus, 83% have received their first dose, and 73% 5 and older are fully immunized. And so we would want that to be a green dot as well.
Ian, do you have another question as well?
Yes, and I apologize if this has already been reported somewhere, but I know that back in August, there was a confirmed case of the Delta variant. Do we know, is Delta the dominant strain in the NWT right now?
So Delta is the dominant strain in the NWT. We obviously will be testing for the Omicron. We anticipate right now what we have is about 500 so confirmed cases in Canada, but that's the tip of the iceberg. These are confirmed Omicron, but we anticipate there's a lot more right now than what's been officially reported because it's still pending. But half of those are in Ontario, and then we see BC has a high number and Alberta has a high number. So the top three is Ontario, BC, Alberta. And because we do so much travel in Alberta, we anticipate that the Omicron will likely be introduced in NWT, likely when people return from travel. And what I'm looking for right now is Delta variant is still the dominant variant in Canada, but because the Omicron doubles 2 to 3 days and is so much more infectious, I'm looking to see when the Omicron variant becomes a dominant variant in Canada, and that does change. How that would change for us is that we would anticipate a lot more people will pick up the Omicron variant and exhibit symptoms in a shorter incubation period.
Thanks, Dr. Kandola. Sarah from Cabin Radio, do you have another question?
Yes, I think this will be for Minister Green. So yesterday, a news release came out, and you mentioned it this morning, about rolling out COVID-19 tests for students to take home over the holiday break. And at the bottom of the news release yesterday, it said that a larger, I guess, program is expected to roll out more broadly for the NWT, and more information is to come. We've had a few people contact us just asking for a little bit more information. Is there any that you can provide, a timeline, anything like that right now?
Yeah, I don't have a lot more to add. There are tests coming from Ottawa. We've ordered more, and we expect them to arrive within the next few days. There's some concern about how the tests are going to do with the weather. That is to say, they shouldn't be frozen, which is going to be challenging right at the moment since it's so cold in most of the NWT. But I think the idea for the additional antigen testing supplies is to continue to expand the programs that we have in place now. So that's the school surveillance and the Detect NWT surveillance. I'll ask Dr. Kandola if she maybe has some more detail to share. Thank you.
We have ordered additional tests, but and we anticipate to make an announcement hopefully early next week. One of our concerns, as Minister Green has described, is that we're waiting for the shipment to arrive, but it's really important the shipment is not frozen. And so if we get a shipment and the tests are here and they're not frozen, then we can make an announcement. We just don't want to set people's expectations and then not have tests to deliver.
Thanks for that, Dr. Kandola. I'm going to go through the remaining names just in case anyone has come up with a question. Laureen, anything else from Laureen or Julia? You've been writing your answers in the chat, so nothing coming in. And one last call for Thomas as well. Don't see anything coming into the chat. So with that, I think we'll conclude our briefing for this afternoon. If you do have further questions, as Dr. Kandola has said, you can certainly, for the public, can reach out to the Protect NWT office. And for media, if you have further questions, you can reach out directly to the COBRA Secretariat or to the Press Secretary's office here. I'd like to thank Minister Green and Dr. Kandola for your participation today, and thank all members of the media for joining us as well. I wish you all a good rest of your day and a happy holiday season. Thanks very much.
Thank you. Bye.